This is a presentation on connexin mutation. A connexin mutation is a disorder involving the connexin 26 gene. It causes non-syndromic sensory neural hearing loss, or deafness at birth, meaning there are no other abnormalities associated with the mutation. The most common feature of this mutation is a sensory neural hearing loss that can range from mild to profound in severity. The function of the inner ear is affected due to the sensory neural hearing loss. However, the structure of the ear remains intact. It is a genetic mutation of the 13th chromosome in which the GJB2 region is affected and therefore is not caused by environmental factors. A sensory neural hearing loss can also be determined at birth when the mother has either rubella or syphilis during pregnancy. In contrast, Usher's and Pendred syndromes also cause sensory neural hearing loss at birth. However, these syndromes are syndromic and do not affect the connexin 26 gene. In assessing for the connexin mutation, the audiologist should begin with a basic hearing exam. This includes a physical exam, clinical tests, and knowledge of family history of hearing loss or deafness. Since most patients will be infants, clinical tests may include otoacoustic emission test or auditory brainstem response tests. After, the audiologist will use the connexin 26 gene test to determine the cause and location of the mutation. The best indicator of this disorder without genetic testing is a family history of hearing loss from a connexin mutation. This is what a sample audiogram could look like from someone who has a connexin mutation. This is a bilateral hearing loss, meaning that the loss occurs in both ears. People with this mutation will not have a unilateral hearing loss. It is also a sensory neural hearing loss, which is seen through the audiogram because there is no bone gap between the air conduction and bone conduction. We know that someone with a connexin mutation has a sensory neural hearing loss because the mutation affects their inner ear function and not the middle ear or outer ear. This audiogram pictured here slopes from moderate to severe in severity of hearing loss. This is typical of a person who was born with a connexin mutation. However, there are many different ways connexin mutation could be represented, and everyone's hearing loss may differ. Audiograms are great determiners of hearing loss, but because it's a genetic mutation, the patient would not be primarily diagnosed from an audiogram. They're likely to receive genetic testing to find out that they have connexin mutation, and would also receive an audiologic assessment to figure out how severe their hearing loss is. Since this is a sensory neural hearing loss, some patients elect to receive a hearing aid or cochlear implant, depending on the severity of their deafness, but their hearing will only continue to decrease as they age. If they only have a mild or moderate hearing loss, they're likely to going to start with a hearing aid. Since their hearing will continue to decrease though, they will probably get a cochlear implant later in life. Most people with a connexin mutation are born with severe to profound hearing loss, and therefore would just get a cochlear implant from the start. In a histopathological study of the cochlea, it was discovered that there is an intact auditory nerve 21. Therefore, patients with connexin mutations are candidates for cochlear implants. One study has found that a possible insertion of the 35 insert gene is in the region of GJB2 can decrease the severity of the mutation or even completely prevent it if found early enough. Estaville's study stated, the high frequency of 35 deletion gene carriers suggest either a founder effect or a selective advantage for heterozygotes or a combination of both. This hypothesis is supported by a deletion and an insertion in this region of the GJB2 gene. The high frequency of the 35 deletion gene mutation facilitates molecular diagnosis and genetic counseling for recessive and sporadic congenital deafness. Cascade carrier detection in relatives of affected and carrier parents would be feasible, leading to prevention of the disorder and early treatment of affected people. In summary, connexin mutation is born deafness and is not affected by environmental factors. Treatment can vary from person to person, but is often treated with cochlear implants or is not treated at all if the parents are highly visible in the deaf community. Through the help of technology, connexin mutation can be treated.